Hi everyone, my name is Montan Bhatt and I'm the Director of Public Policy for the Colorado Academy of Family Physicians. And I'm here today with CORHIO and their Executive Director, Morgan. And we're just here to talk about what CORHIO is, what the HIE infrastructure of the United States is right now, and what providers really need to know about EMR platforms and just the future of this health information technologies. So first and foremost, we got about 20 questions from our physician members across the state that it ranges from La Junta to Denver. And the first question is, what does CORHIO stand for?
Okay, CORHIO stands for the Colorado Regional Health Information Organization.
Okay. And so what is your guys' mission and vision, and why do you guys exist?
Sure. So CORHIO was established in 2007 in preparation for the federal ARA high-tech initiative. In 2009 was designated as the state designated entity in Colorado for health information exchange, and has been working to connect providers since 2010. Today we have 95% of the hospital beds in our region, over 600 users of the community health record facilities, which represent about 6,000 different users. And we work basically to connect electronic medical records between systems so that you can have the type of information that you need to make well-informed clinical decisions at the point of care.
Right. So the biggest question that we got, the number one question, was how is it going to help individual practices, and because currently right now with the EHR technology, they're already having a difficult time implementing it, and just getting onto an EMR platform is a pretty big headache. And then now we're adding another layer where we're connecting all these EMRs, right? And how do you envision CORHIO helping the actual practices and the family practices and the small practices in Denver and La Junta and everywhere else?
Sure. So CORHIO really is here to make life simpler for providers by bringing together a bunch of disparate data sources that you probably spend either large amount of time gathering yourself or a large amount of staff time gathering, whether those are referral records, hospital discharges, admitted information, lab reports, procedures, you name it. I'm an ex-practice administrator myself, so I know.
Well, where did you, where was your practice?
I ran Plains Medical Center in Eastern Colorado, headquartered out of Lyman, with 4 practices on the I-70 corridor.
Wow, okay. And continue, sorry, I had to cut.
No, so I mean, really, the value proposition is twofold. The first one is obviously to coordinate and simplify the management of health information from a bunch of different sources into a single community health record. And then the second really is to provide an opportunity for providers to better compete in more of a managed care environment by being able to have a global view of what's happening with their patient and take on potentially different levels of risks in their insurance contracts.
Okay, so you mentioned managed care, and my doctors remember the 90s and the difficult time that HMOs created and other entities around just managed care. And how will CORHIO make it easier on that front to manage someone's care, how to manage a population?
So I like to say that where we are today is managed care 2.0. In the 90s, the system itself was the gatekeeper for services. Most things required authorizations through their HMO or through their PCP in order to move into more specialized areas of healthcare. And what we see today is a similar situation, only kind of flipped on its head, where the patient is the gatekeeper And the provider essentially, I think, is going to be asked to bear the risk for that patient's decisions. So understanding what's happening with your patients in the system is really the most critical part of being able to compete in this new managed care environment. Risk-based contracting is really going to be about accepting different levels of risk for certain populations and understanding what's happening with that population, how they're using the system is one of the ways that you have to immediately gather information in order to even begin to take risk on this population. So CORHIO offers the ability really in that space to be able to have real-time knowledge of where your patients are accessing the different systems of care.
So if a patient goes into the hospital and let's say, this provider is on Epic, which is one of the more popular EMRs that I think we'll probably talk about in a little bit. And your patient that you've taken risk for, right? That you say you're going to keep healthy. If they go to the hospital with CORHIO, and currently right now I'm pretty sure it's not two-way connected, but you guys are test piloting that, and it's going to be two-way connected pretty soon, right? Or if someone goes to the hospital, it goes into our primary care provider's EMR instantly. That's the goal, right? And that's called two-way communications between an EMR platform.
Well, so that's what we do right now.
Okay.
We take hospital information and pass it out to a lot of places in the system.
Okay.
What we're actually developing right now, and what our big effort for 2015 and 16 is going to be, is turning that equation around and passing the information back to the hospital systems and the other care settings. So that's bidirectional. Okay. Right now, within an ambulatory provider's EMR, they can have all of the information around admits and discharges, transfers, procedures, radiology, lab, and transcription.
But in the old days, when a primary care provider got an X-ray for something and put it into their system, it would never reach the hospital, and then the hospital would have to do it again. So this fixes that type of issue.
So the ambulatory practice back to the hospital is what we're working to develop, and not develop. The technology is there. It's the use case and the implementation that we're going to be working on in 15. Okay. But if the service originates at one of our sending hospital facilities, then that information would come to the ambulatory provider.
Okay. So we only have Morgan just for a little bit more, and this, I guess this will be the last question. How far is for Morgan at least? Well, we're going to get to the EMR choosing portion in just a little bit. How far along is CORHIO compared to other state-based health exchanges?
CORHIO is one of the largest, most successful health information exchanges in the nation for a lot of different reasons, primarily though because of the collaborative nature that exists in Colorado. From CORHIO's inception, the healthcare industry here in Colorado has seen the value in participating and proliferating HIE for the better coordination of services for the patients in Colorado. So that's really where everything has started. We've been very successful at signing up both practices as well as hospitals. We've got one of the largest LTPAC programs in the nation with
what does that mean?
Long-term post-acute care facilities.
Okay. Sorry, I had no idea.
It's fine. So today there are about 5.3 million people in the state of Colorado, and in CORHIO's Master Patient Index, there's approximately 4 million.
Wow. So you have 80% of
80% of the population have a record within CORHIO's community health record.
And what percentage of the provider network?
We think that the denominator for physicians in Colorado is somewhere around 6,000.
Okay.
And we have approximately 2,000 signed up and using the community health record. And that does not include all of those providers who work with CORHIO through the integrated EMR. So there's about a third of all licensed medical providers in the state using the community health record. And then there's a huge portion that we can't necessarily track using CORHIO interfaces directly through their EMR in the different systems.
Okay, and well, I guess that's all the time we really have to speak with you.
One more, give me one more.
Well, so a lot of our providers, almost all of our providers, are probably connected to CIS by now, or,
Okay, yep.
or in some way, if they're providing immunizations, they're connected to CIS. Is CORHIO connected to CIS, or are you guys going to help move that information around?
So CORHIO is a contractor to CDPHE to coordinate the CIS integration with the community immunization records. We also do newborn screening results, cancer registries. What's the other? And syndromic surveillance for CDPHE.
So, and all this stuff is going to help reduce duplicative efforts and just make sure that information is flowing both ways.
Absolutely. I mean, you know, immunizations is actually a good example of how administratively burdensome some of these programs are. If you're dealing with a VFC patient, you have probably a VFC paper log that gets audited on a regular basis. You enter it, exactly. You enter it into your EMR, and then hopefully you go out and put it into the immunization registry. So you've got triplicate entry, and obviously, going back to where we started, our goal is to make life simpler for providers and hopefully streamline and reduce the duplication of all these different systems.
So if you had an overarching goal, it'd be to make sure that there's no duplicative efforts, both on putting the information, but also getting, you know.
Well, I mean, yeah, not only for the provider, but for the patients as well. I mean, nobody wants to hold their kids down for 2 immunizations if they didn't need to, and obviously that's additional cost to the system. And so, you know, I think that the value proposition for using CORHIO is pretty widespread. At the end of the day, our goal here is to make sure that the right information is in the right hands at the right time.
Great, awesome. Well, thank you so much.
Absolutely.
So we're going to start the EMR portion of it, and I believe Kelly is going to I've been working with Kelly, but Aaron's the one who's going to be talking about the EMR platforms and what to look out for. So let me just bring that up on here for everyone. All right. So this is, we have the PowerPoint up for everyone, and just get started.
Okay, thanks for joining us, everyone. A quick background on me. I've been on a regional extension center contract for the past 5 years, assisting physicians with selection, implementation, and meaningful use of EHRs. Today, I'm going to go over more selection in general. I'll mention a few EHRs in passing, but hopefully this will help you both if you're selecting and if you're in a situation where you're looking to change EHRs. These should apply as well. Today, we started with some slides from Morgan, but since you did an interview with him, I'm just going to flip through the general CORHIO slides. These are available. Are you going to provide the slide deck?
Yep. Okay. We'll be sending out an email blast of all of this and with the video as well. So
great. So you'll have access to those should you want to look at them, as well as I've embedded a lot of links to resources in the slide deck, so you can of course access those at a later time as well. To start, when you're looking at an EHR, there's a lot of different things to consider. It includes what are your current problems that you're trying to solve. So if you have an EHR that right now that it's not providing the solution that you want to identify what those problems are. If you don't have an EHR, what do you want an EHR to do? For example, maybe you're tired of doing the chart hunt search, or you want 24 access to your charts for on-call purposes. Once you identify what your issues are, start to think of lists of functionalities and features, along with how important that feature is for your practice. So you probably have a scale of, yes, this absolutely needs to be a function within my EHR. such as easy access to lab results, or something that would be nice to have is online bill pay for patients. ONC has actually created a matrix tool to assist with this. You can use it as a starting point and then edit questions as you start to identify your priorities and needs. I can pull up that tool real fast. So this is the ONC tool. You can see it has questions. Is it not?
Let me just bring it up.
Sorry, hold on one moment.
It's this one.
Yes.
Right.
Okay, so this is the ONC tool. You can see it lists questions pre-written, and then that's of course what you can edit. And then you can, in the first column B, you can rate your priority, and then as you do your vendor demos, however many demos you do, you can rate how well the vendor did on that particular aspect of the EHR. That way it's easy to track when you go back to look at what EHRs you looked at. You can remember what one did well with each section. I'll bring it back to that. Okay. Once you decide what you want out of your EHR, the next step is to start looking at vendors in particular. There's countless vendors out there, and they all claim to be the best, and that can be the challenging step, is how to identify who's the best for your needs. There's several key sources that you can look at to help with that search, starting with the CORHIO connectivity report. If I just click this link, will it show?
No, but I'll just bring it up.
Sorry.
No.
It's the last one I'll put. I just want to show you a quick preview. It's on our website. We keep it up to date as we constantly connect with EHRs, but what's nice about it is there's actually live links to each vendor's website, so it's easy to get to each vendor. As you can see, it tells you whether they're currently connected to CORHIO, or towards the bottom, it's ones that are in process that'll be connected soon. The second column tells you whether there's a fee or not. Most vendors do charge a fee on their side to connect to CORHIO. And then also important, I'll touch on a bit later, is whether they're certified or not to stage 2. So you definitely want to see a yes in the stage 2 certified column. And then back to the PowerPoint. And then secondly, another good source is the class ratings. Class is like the consumer reports of the EHR industry. It does cost a fee to access, but it's generally pretty reasonable for small practice providers. And it provides valuable up-to-date info for EHR ratings. A lot of times they base them on a variety of factors, including customer experience. So that's a good place to start as well. They do have special reports for small family physicians and how those EHRs rate. And then finally, once you narrowed your search to which EHRs you want to look at, double check and make sure they're ONC 2014 certified. It's important to note that this year there was an upgrade in certification. So don't just check that they're ONC certified. You want to ensure that they're 2014 certified. And that can be done on this link down here. You can actually just pull up. You can search by vendor or by EHR name. And then you'll want to ensure. The other thing to note in 2014 that changed is there can be a modular EHR or a complete EHR. You just want to note that if it's a modular EHR, that means there's a component missing to being fully certified. So you want to know what that component is. It means you can maybe be able to buy it from the vendor or from a third party, but you would want to know what's missing to make it fully certified as well. After you've narrowed down your vendors, you can start to think what type of EHR you want. There's 3 options. There's server-based systems where the hardware is physically in your office. There's also hosted at a third-party site, so it's still server-based, but you have a third-party vendor actually with the server on their site. And then there's a cloud-based or software as a service where everything is essentially in the cloud. There's major cost differences between these options. IT support for server-based systems is significantly higher. You have to keep in mind that you have to keep your server up to date, and upgrades are much more complex as you have to schedule them and ensure they go on all your system. The cost for keeping your server up to date is tough as well. However, server-based systems will usually offer a lot more flexibility and can be easier to change the templates, more customizability. Also with server-based systems, there's more security on your end. You have to ensure that your server is secure, and you have the responsibility that if that server is stolen, that was your responsibility to keep it secure. So it puts you a bit more at risk. Cloud-based systems can be nice because upgrades are usually automatically just pushed to the cloud. Everything's stored in the cloud, so you don't have to worry about keeping the server up to date or the security risk of having the server in your office. However, there's less customizability in cloud-based systems. So if you're looking for a highly custom system, that may not be the choice for you. Try to find a system that meets your needs rather than overly customizing the system. Too often I've seen practices pick an EHR and then try to overly customize it to make it work for them, and then that just never really works. Upgrades come through and then the system doesn't work anymore the way that they were using it. So if you can find a system that works out of the box, that's your best case scenario. You'll also want to consider if the vendor offers a practice management system that is integrated with the EHR. Most vendors these days do offer a practice management system, so that's something you'll want to view during the demo. Make sure it's one that's functioning well for you. They also can usually connect to whatever your existing practice management system may be, but I say be very wary of that option, as the bridge between the two systems can become a constant problem, especially after upgrades. The data may not transfer as well. And also with these increasing quality reporting programs electronically, it's becoming an issue, as usually the demographic information is stored within the practice management system. And if you have a non-integrated practice management system, that data doesn't transfer well and makes reporting quite difficult for these quality programs such as Meaningful Use and PQRS. Next, you'll want to find out what reporting functions are in the EHR and how easy they are to report with. So for example, if you're interested for doing Meaningful Use, you want to see the Meaningful Use dashboard. Also, you can ask about PQRS if that's something you're interested in reporting, as well as registry reports. What sort of data can you pull out that would be beneficial to your practice in the registries? Another thing to consider is the capability of connection. I've listed here everything that the HIE or CORHIO offers. You can either consider connecting to CORHIO or you can create individual connections for anything on this list that may be of interest to you. The thing I say to keep in mind is typically the EHR vendor charges for each individual connection, and then you'll also have a connection from whatever third party that you're, or a connection fee for whatever third party that you're trying to connect to. So it's just what makes more sense. Do you want to create one connection, or if you have several connections you want to create, the cost can add up quickly. Another thing to consider are the costs. You want to get anything in writing directly from your vendor. Just because a colleague paid for something at one price doesn't mean the vendor's going to charge you the same price, as well as negotiate the price that's first offered. That's not usually the best price. And you want to get a full listing of prices. Just because they give you one price for one thing doesn't mean that there's not additional fees for certain things. So this link embedded in the EHR, you can click on it when you have the slide deck, but it does take you to another ONC tool that helps you evaluate costs. And at the top of the tool, it's another Excel spreadsheet. It lists various fees that vendors typically charge, so that can give you a starting point of what to ask as far as if they charge for the different fees, if it's a feature that you're interested in. You want to consider what fees are upfront costs, so costs for the system, and then continuing ongoing costs such as maintenance fees. And then there's usually separate add-on costs for things like portals. And then a lot of vendors are also charging additional fees for quality reporting. So both for their dashboards for maybe PQRS or CPC, or PCMH, as well as actually submitting the data. So for programs like PQRS, if you want to electronically submit that data through your EHR, you want to ask your vendor what fees would be involved with any sort of quality data program that you're trying to submit. Vendor-wise, eClinical tends to have lower upfront costs, but quickly they add up as you add on their different interfaces and reporting. So that's a good example of one of the systems that has different costs. Athena does your billing for you and then charges a percentage of all your collections, including any incentive payments such as meaningful use. Amazing Charts usually offers a low cost, but it's a more basic product. There's no right or wrong pricing model. All these are just different models, and you have to really drill the vendor on what their costs are going to be so you fully understand the costs of the entire product and not just the basic product before committing to anything. You'll also want to ask about their customer support for the product. How fast do they respond to the ticket, but also how fast do they resolve the issue, not just respond to it, but how fast do they resolve it? And is their support US-based, or will you be receiving a phone call from someone overseas? It's important to note a lot of these vendors are using overseas support, and it can be quite difficult to understand when they're talking to you about highly technical things. So if you can find a US-based support system, a lot of times that can resolve a lot of issues. Finally, you want to consider the vendor's business sustainability. You want to be wary of new-to-market vendors. There's a lot of competition in the market right now, and you want to make sure that your vendor is going to be around for a while. That was another reason why I said to make sure they're ONC certified. That's the best starting point to make sure that they're going to be around. They've taken the time to go through the certification process. There's no guarantee, even though you take the time to look into the vendor, but it's the best place to start with this highly competitive market. Next, I want to touch on free EHRs. A couple of the popular free EHRs are Practice Fusion and CORHIO. There's certainly other ones out there. And there's definitely some certain scenarios where these EHRs are a good fit. However, there's some important things to consider before just jumping on the bandwagon that since it's free, I should use it. Essentially, you get what you pay for. They're usually very basic systems with limited reporting functions and no customization. Practice Fusion will not connect to CORHIO, and the free EHRs usually have limited interoperability features as far as connecting to labs or any sort of radiology hospital type connections. It's usually a little bit more difficult. If you're considering a free EHR, make sure you understand what the vendor does with your data. Often in the agreement to download the EHR, it states they will de-identify your PHI and sell it for marketing purposes. Not all of them do that, but you want to make sure to read what that agreement is and if they are going to do anything with your data. The EHRs are also usually ad-based, so you want to make sure that you're okay with seeing ads on your EHR as you're seeing patients. Another thing to consider is that although it's free, what features are you missing from a fee-based EHR? These features could provide staff with more efficiencies and in the end save you money if with increased staff efficiency and workflow. But in the end, they are free, so there are some cases where that is the best fit and the best option. As far as demoing, I say demo a minimum of 3 vendors. Make sure you invite key staff members from each area of your practice, front desk, back office, whoever else you need to invite. Provide the vendor with a list of features you'd like to see, and also describe a few scenarios that are typical for your practice and ask to see how that scenario works in that particular EHR. Make sure you take control of the demo. Don't let the vendor spend 10 minutes on a feature that's useless to your practice. Just ask them to move on. This is a key question, to ask the vendor how much of the EHR being demoed is customized and how long it takes to get it to that level of customization. A great example of that is Greenway and NextGen are highly customized, which can be a great benefit. You can tailor the EHR to your needs. However, it's important to understand how much IT support it takes to get the product to that level of customization that they're demoing. After you're done with your demos, you can select your top EHRs. And the first thing you want to ask is there a local practice you can do a site visit with? It's really important to see the EHR in an actual practice and how it's being used. I would be willing to travel across the state if necessary to do this. It provides really valuable information actually seeing it in the practice. Not all vendors can provide this, but it's definitely a good thing to request. Final thoughts are, once you select a vendor, make sure to read the contract. I can't stress this enough. I've walked into so many offices that the contract was just signed without even reading it, having no idea the fees that were involved, continuing. Have a lawyer review the contract for red flags. Although the large vendors' contract terms are usually not that negotiable, it's still worth having it reviewed. This is something that you're committing to, and there can be big financial implications around it. Pay special attention to what is done upon contract termination, including how you get your data. You want to make sure that if you want to end your terms with this vendor, that you can get your data and use that data within a different system. Do your research and spend a lot of time up front looking at these products. It is very difficult to switch EHRs and very costly. So you want to make sure you get it right the first time. And finally, when it comes time to implement your EHR, invest in training. Make sure all staff is committed to learning the product and invest in follow-up training within a few months after the initial install to ensure you are fully using the system and not just using workarounds within the system that you've taught yourself along the way that can create bad habits. The number one reason for failed implementations is lack of training. You've made the investment in the software, so now make sure to make the commitment and investment to actually use the full benefits of the software. I've included a couple more resources. The ONC is a practice transformation toolkit. This is really thorough, and for some people it may be good that they want a full spectrum, really thorough toolkit about it. Has everything from EHR selection to PCMH, ACO information. If you're just looking for certain various resources, I put a link to the ONC website, and it's specifically for small 1 to 10 provider practices looking at EHR implementation. There's all sorts of resources in there. It's actually where I got the other resources that I listed earlier. There's also a resource on there to help review contracts if you want a resource with that, as well as various other things. So it's a good thing to check out. See if there's anything else in there that interests you. And then finally, CORHIO does have a transformation support services team. I'm on that team, and we assist with EHR selection and implementation, meaningful use. We can do security risk assessments related to meaningful use, and we also help with quality improvement reporting programs such as PQRS and value-based modifier and PCMH. And my contact email was listed on there as well.
All right. Well, that was a great presentation, thank you to CORHIO for having us today, and thanks for staying on.